This world we're living in today is more toxic than ever before in history, and people are accumulating more toxins at earlier ages than ever before, and humans do not have the detoxification mechanisms to deal with all of these chemicals. There are a number of studies now that show that when women have high levels of phthalates in their body, phthalates are chemicals used to mold plastic. And I'll give you an example of a study, 2016, Chicago, 136 women in the 8th month of pregnancy. They measured their urine for how many phthalates do they have in their urine. So they measured in the urine, how much plastic chemicals do they have? And then they watched the offspring of those pregnancies. And when those children turned 7 years old, the researchers reached back out. It's time now to do the IQ test. Every single child whose mother was in the highest category of phthalates in urine during pregnancy, their IQ was 7 points lower. 6.7 to 7.6 points lower. Every one of them. Every couple of childbearing age that wants to start a family needs to be tested first to see how many toxins do they have in their body right now. And if they're high, you need to take the time to get those out of there before you try for a pregnancy. Toxicity is a huge emergency brake on brain function in general.
So I am super excited to chat with Dr. Tom O'Brien. We are going to be having a comprehensive discussion on how you can fix your brain. Dr. Tom O'Brien is considered the Sherlock Holmes for chronic disease at recognizing and addressing the underlying mechanisms that activate an immune response is the map to the highway towards better health.
So my entire career has been based on understanding the principles and investigating to see what are the triggers for each individual patient that comes in, because they're always different.
I'm going to ask you something. Since everybody pretty much that you tested for test positive for toxins, why do the testing and why not just jump into like detoxification?
The answer is,
and I think the first time I saw you was actually at the Institute for Functional Medicine many years ago. I think it might have been in 2015, 2016. So again, you've been doing this a long time, even before then. But we're both chiropractors. We're both doctors of chiropractic. But again, you really dive deep into autoimmunity, again, the book with the brain. So what led you down this path to write your books and to be doing what you're doing currently?
Well, it started when I was in my internship, and my wife at the time, we couldn't get pregnant. And I called the 7 most famous holistic doctors I'd ever heard of. I called George Goodhart and Jonathan Wright and Major DeJarnette and just any of the famous doctors that I had heard of. And I asked them all, what do you do for infertility? And they all told me what they did, what they would do. And I wrote it all down. I put a program together. We were pregnant in 6 weeks.
Wow.
And my neighbors, we lived married housing on campus, and my neighbors asked if I'd work with them. They had been through artificial insemination and nothing had worked for them. And I said, well, I don't know if it's going to help. I don't think it's going to hurt you. Okay. They were pregnant in 3 months. So we're now 4 months pregnant, and we are hot to trot. We're telling the world how excited we are and what we're finding out. And one of our friends would have a sister in Wisconsin. We were in school in Chicago, and she would call and say, can I drive down and see you, please? And, I wasn't seeing patients, but I couldn't say no. And so they'd come to my dorm room, and I was treating patients out of my dorm room. And the president of the college called me in one day and said, we can't do this. I said, I understand. And I kept doing it. I was just hot to help people. And we helped a lot of people with pregnancy issues, whether it was infertility or recurrent miscarriages or a history of premature births. And we found that consistently, time after time, every single one of them had some common links. first we had to make sure all the parts were working, that there was nothing organically that made it impossible for pregnancy. And then there was one consistent mechanism that was always there. Every hormone related problem. At the time I was realizing, well, everyone that's got hormone related problems has inflammation, that they've got lifestyle habits, which means where they live, if they live in a moldy house or they're eating foods that are triggering inflammation in their body, or they have high levels of arsenic or lead or some other toxin in their body. But every single one of them. And when we would address those triggers of inflammation, then they always felt better every single time. And most of the time, surprisingly, within a few months, we're getting a call, we're pregnant. And so that started me off. So I opened my practice already practicing functional medicine. This was 1980. I happened to be in Dr. Jeff Bland's first talk ever in Chicago in 1978. So I'd heard these concepts about functional medicine. So as I was learning all of the technical things about being a chiropractic physician and a nutritionist, I was absorbing them from the ideas of functional medicine, which means identify the triggers of inflammation and get those triggers out of there and watch and see if the body starts functioning better. And the results have been just sometimes miraculous, over the last 40 years. It's a long time, but that got me into all of this. So my entire career has been based on understanding the principles and investigating to see what are the triggers of inflammation for each individual patient that comes in, because they're always different. There's some common ones, but it's always unique to the individual. So there's no shotgun package approach that you can do. And that's what the book, You Can Fix Your Brain, is all about, is understanding that there are so many triggers to the inflammatory cascade in your brain. But here's how you identify them. And here's what some of the clues are as to where to look. That's what the brain's about, with 36 to-dos for the brain. I'll just give you one example of the to-dos. There are a number of studies now that show that when women have high levels of phthalates in their body, I'll give you an example. Phthalates are chemicals used to mold plastic. And I'll give you an example of a study, 2016, Chicago, 136 women in the 8th month of pregnancy. They measured their urine for how many phthalates do they have in their urine? And it's the residue from plastics. And we've all heard about microplastics and now nanoplastics, and that they're a big problem. So they measured in the urine, how much plastic chemicals do they have? And they put the results into fourths, the lowest amount in the urine, the next, the third, and the highest amount. And then they watched the offspring of those pregnancies. And when those children turned 7 years old, the researchers reached back out and said, hi, it's time now to do the Wechsler IQ test, which is the official IQ test. And there's not much in medicine that's all or every, but this was every single child whose mother was in the highest category of phthalates in urine during pregnancy, compared to the children whose mothers were in the lowest category. Every single child in the highest category, their IQ was 7 points lower, 6.7 to 7.6 points lower, every one of them. That doesn't mean anything to anybody until you understand a 1 point difference in IQ is noticeable. A 7 point difference is the difference between a child working really hard, getting straight A's in school, and a child working really hard, really working, getting straight low B minuses and C's. That this child doesn't have a chance in hell of ever excelling because their brain never developed to its genetic potential in utero. Wait, what? What? And when you learn that, and there are many studies that give that kind of information looking from one way or another, when you learn that it's the toxicity in mom that has, and dad, that has a huge contribution to babies' brain function as they grow up years and years after being in the womb. When you learn about that, then you understand why I say every couple of childbearing age that wants to start a family needs to be tested first to see how many toxins do they have in their body right now. And if they're high, you need to take the time to get those out of there before you try for a pregnancy. I'll give you one more example. About 16 months ago, a paper came out of men at infertility centers, and they found that the glyphosate level, which is a chemical used on genetically modified foods, the glyphosate level in men's semen was 400% higher than the glyphosate levels in that man's blood. Wait, what? You mean the semen that's made in the testicles, that the concentration of glyphosate is 4 times higher than in the guy's blood? Yes, it accumulates in the testicles in men. The result being that the DNA gets damaged because of glyphosate, and there's studies that show all that. So the DNA gets damaged, which then damages the sperm that's in the semen, and the semen carries the sperm with ejaculation into the woman. And so the pregnancy, if it's from a damaged sperm, puts the child at risk that they never develop to what their genetic potential could be. And this is like, wait, what? People don't know this. They don't know this. So when you learn this, and don't believe me, just read my book. Look at all the studies. There's 346 studies in that book. And when you say, wait, that can't be true. My doctors, the experts at the fertility center who are charging you tens of thousands of dollars, never check this stuff. They don't see. They want to make sure the woman's fallopian tubes are open and she has the eggs and she has enough hormones. That's all good, but that's technology from 1990, and that's not cutting edge. You have to see, is this couple so toxic that the levels are accumulatively putting them at risk of damaging the sperm and damaging the eggs? And we've never had a couple come back normal on a first test. When you
that was my question. I was going to ask you that, because she said if they're high, of course, right, treat it. So my question to you was, have you ever done a test on a couple where it looked good?
Never. And these tests are highly, highly accurate. Mm-hmm. They're highly accurate. But this world we're living in today is more toxic than ever before in history. And people are accumulating more toxins at earlier ages than ever before. And humans do not have the detoxification mechanisms to deal with all of these chemicals. Our immune systems are designed by what allowed our ancestors to survive. We carry the genes of our ancestors. And the ancestors who survived and reproduced and produced the lineage that we came from now, their immune systems were designed to handle specific things that were risk factors to kill them. Bugs, parasites, viruses, mold, fungus, and bacteria. That's it. We don't have any aspect of our immune system to deal with lead poisoning. We don't have any aspect of our immune system to deal with red dye number 42. So when we get exposed to all of these things, the immune system operates in the only way it can when there's a threat: bug, parasite, virus, mold, fungus, bacteria. And that means the immune system produces inflammation. And the inflammation tries to kill this thing, but you can't kill red dye number 42. It just sits in your cell, but there's now more inflammation that damages the cells around that. And we know now from the Center for Disease Control, the CDC, that 14 of the 15 top causes of death are chronic inflammatory diseases. It's always inflammation, whether it's cognitive decline, dementia, diabetes, atherosclerosis, heart disease, rheumatoid arthritis, autoimmune diseases. They all are inflammatory diseases. It's an immune system that's been activated to protect you. The immune system hasn't gone crazy. It's trying to protect you. So the question is, what is it trying to protect you from? This is like basic 101 common sense stuff that always has to be addressed, but there's no profit in this. So it's not taught in medical schools. I'm not challenging the students who went to school and then became doctors, but this is what they've learned. They've learned that you do these tests to identify what they're checking for, and then you write a prescription, or you're doing some other invasive therapy. But they're not taught. They're not taught these basic 101 principles, so they just don't know. Yeah. But that's why you have such a successful track record working with infertility couples when you include this approach. I'm not saying only this approach, but you include this approach. And you always test for this first. How toxic are you, Mr. and Mrs. So-and-so? And when the test results come back and you do an, oh my God, I had no idea. Then you tell the patient, do not get pregnant until we get this stuff out of your body. Then you have a better chance of baby developing to their genetic potential, whatever their potential is, right? You're not going to put the emergency brakes on their development. And you ever back out of a driveway and you say, what's wrong with this car? It's moving, but it's not moving very well. Oh, the emergency brake. And you let go of the emergency brake, then you back up just fine. Toxicity is a huge emergency brake on brain function in general, which is what this topic is today, but on infertility. It's a huge emergency brake that you just have to rule it out. You just have to do the right tests, simple tests to rule it out. A simple urine test will tell you, do you have too many toxins in your body? The urine test, they look at this one simple urine test. It's called the total tox burden. It looks at 87 different markers in one simple urine test. I mean, it's just remarkable. And when you look at that, and if you're clean on that test, and it's a highly accurate test, and if you're clean, great, go for it. Let's figure out what else might be inhibiting you having a successful pregnancy, but we don't have to pause on your attempts right now.
Yeah, I like to play devil's advocate. I'm going to ask you something, and I'm pretty sure I'll know what the response is, but
sure.
Since everybody pretty much that you tested for test positive for toxins, why do the testing, or why not just jump into like detoxification?
Well, that's a really good question. The answer is you can do detoxification to begin with, and people start feeling better pretty quickly. But if you don't know that you had 24 different toxins, and now after your detox protocol, you've got 7 left, but you feel great. You feel great. But you still have this stuff going on that is not contributing to the lousy way you were feeling, right? You've got to have a baseline. If you don't have a baseline, you're shooting in the dark. I call it shotgun medicine. You're just blasting. Well, we know detox always helps, so let's just put everybody on a detox program. Now, if you want, I guess it's hard to argue with, don't try and get pregnant. Do the detox program, then we'll do the test and see what's left. But it's always better because you're asking people to change their lifestyle, their basic food selections, living environment sometimes. You've heard now recently that the polyethylene materials in many of these athletic clothes that people are wearing, the gym shorts and the bras, that they cause all kinds of problems for people, hormone problems, right? But you don't feel bad when you put on a pair of gym shorts and you go out for a run or you exercise and you're sweating, so you're opening up your pores, which means these polyethylene chemicals and these toxins, these phthalates are coming in through your testicles or coming in through your breasts. You don't know that's happening. You can't feel that. So if you don't have a baseline and then you recheck 2 months, 3 months, depending on what your detox protocols are and what your starting point is, you're shooting in the dark.
Yeah, makes sense. So you get that baseline, and then you can see exactly how many toxins you have, the levels that they're at. And then after addressing that, you could see the improvements, and hopefully they'll all be greatly reduced and not, I mean, within the lab range. But again, you don't know unless you retest. Like you said, maybe
That's
you have
exactly
like
right.
a few dozen, and yeah, like makes perfect sense. So inflammation, essentially, for those who aren't taking this approach, I mean, it's really starting in the womb, it sounds like, just because we're all getting exposed.
It really does. Well, it starts preconception. My new book that I'm writing now, it'll be a year before it's out, but the working title is Healthy Conception, Healthy Pregnancy, Healthy Delivery, Happy Baby. And you've got to deal with all 4 categories. This world we're living in today, the statistics of the percentage of our children that not only are obese, but the percentage of our children with attention deficit or autism or on antidepressant medication or anti-anxiety medication is going through the roof. Only in the US. In other countries, it's not as bad. It's bad, but not as bad as in the US. But it's just going through the roof. It's startling to look down the road and see what's happening with our most precious treasure, our next generation, our children.
Yeah, I agree, and look forward to having you back on once you get that book released in, it sounds like 2026.
Yes, thank you.
Okay, wonderful. So when these chemicals, they affect the brain, but they also affect other areas, including the gut. And so can you talk a little bit about that relationship between the blood-brain barrier, the gut barrier?
Oh, yeah, the blood-brain barrier and the gut barrier. The blood-brain barrier is the most tight of any barrier in the body. Some things can get through, but most things can't. That's the blood-brain barrier. The gut barrier is the same. Some things can get through the Mrs. Patient, this is how you think about it. Your digestive tract is a tube. It goes from the mouth to the other end. One big long tube, 20, 25 feet long. The inside of the tube is lined with cheesecloth. When you eat food, think of proteins like a pearl necklace, and the acid on your stomach undoes the clasp of the pearl necklace. Now you have a string of pearls. It's your digestive enzymes in your mouth and in your gut that act like scissors to cut that pearl necklace into smaller and smaller pieces. They're called peptides. But each piece gets smaller and smaller and smaller until you're down to each pearl of the pearl necklace. That's called an amino acid. And we know those as the building blocks for new muscle cells, new bone cells, new brain cells. The amino acids are raw material to build new cells to keep us young and strong and healthy. And when you eat a hamburger, most of us take 3-4 chews, and then we gulp down. We should chew it 15, 20 times, but we don't. We gulp. But there's no way that ground meat can get into your bloodstream. There's no way. If it does, you might die. I mean, it's not okay. It's got to be broken down into each pearl of the pearl necklace, down to the amino acids. Then they fit right through the cheesecloth and get into the bloodstream. And your bloodstream's just a highway. Everything's going in the same direction, but it's like bumper cars in there going in the same direction. They're all bouncing into each other, but it's just a highway. But these are the raw materials to make new cells. And that's the job of the cheesecloth, is to restrict so only certain size molecules can get through. Well, when you get a tear in the cheesecloth, that's called leaky gut. When you get a tear in the cheesecloth, now bigger molecules called macromolecules get through into the bloodstream before they should be able to get through. There's nothing wrong with them. It's good food, but they've got to be digested down into each pearl of the pearl necklace. But if you've got tears in the cheesecloth, some of those macromolecules can get through before they've been digested completely. Now they're on the highway, these big clumps of meat in this example. And the immune system says, whoa, what's that? I better fight that. And you start making antibodies to beef or to chicken or to tomatoes or to bananas. I mean, it doesn't matter what the food is. If you have a leaky gut and these molecules get through into the bloodstream, your immune system, trying to protect you from this threat, is going to make antibodies to fight that food. Those are the people that do 96 food panel test, and they come back sensitive to 25 different foods. And they say, oh my God, that's everything I eat. Well, of course it is. It's your immune system trying to protect you from these macromolecules. You heal the gut, and 2 months, 6 months from now, whenever you retest, now you're sensitive to 2 foods, maybe 3. And those are the ones you stay away from forever.
Yeah.
But that's the leaky gut. The same thing happens in the brain. You've got a cheesecloth around the brain, the blood vessels in the brain. Now, your brain is so important that 2% of the body weight, about, is the brain. About 2% of the body weight. But at any time, the brain has 18 to 20% of the body blood in the brain. There are thousands and thousands of tiny little blood vessels in the brain. And they all have this cheesecloth on the inside of the blood vessel to make sure nothing gets into the brain tissue that's not supposed to. But when you have a leaky brain, that's why checking your brain for inflammation is so important. Because it's, in my opinion, now I can't find any science to validate this. Now I'm telling you, this is my opinion. Everything else I'm telling you is not. This is what they're teaching at Harvard Medical School. But this is my opinion. That's why, as a doctor, as a clinician, when you identify the inflammation in the brain, you're identifying one of the earliest organs that's being damaged by too much inflammation. Now, I'd like to show you a few slides, if I can, that might put this in perspective. Would that be okay?
That would be awesome.
Perfect. Here we go.
If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter.
So this is where I teach our doctors. So this is a study. I'm going to get a little geeky with you for a minute. This is Melissa Arbuckle. She works at the VA, and she looked in one VA center for the number of people that were diagnosed with the autoimmune disease lupus, systemic lupus erythematosus. And she found there were 132, I think it was, people in this one center. Now, if they're in a VA center for treatment, they're veterans. If they're veterans, they were in the armed forces. When they were in the armed forces, when they were healthy in the Army, the Navy, the Air Force, the Marines, they had their blood drawn many, many times over the years in the armed forces for one reason or another. What most people don't know is that the government's been saving and freezing most of that blood since 1978. They've got tens of millions of samples of our service people's blood. Well, Dr. Arbuckle knew this, and she asked for permission to look at the frozen blood of the currently diagnosed lupus patients when they were healthy in the Navy or the Army or the Air Force. She got permission. What did she find? As she wrote here in this paper in the New England Journal of Medicine, she said antibodies, and there's 7 antibodies to lupus, they all are elevated years before a person has a symptom. They've got no symptoms, they feel fine. I call it the I feel fine syndrome. I feel fine, I don't need to test anything, I feel fine. But the antibodies are elevated. And by definition, when you have elevated antibodies, you're killing off more tissue than you're making. Mrs. Patient, you have an entire new body every 7 years. Every cell in your body regenerates. Some quick, some slow, but every cell regenerates. How does that happen? Well, your immune system has got to get rid of the old and damaged cells to make room for the new cells. Okay, that makes sense. And how does it do that? Well, the process is called autophagy, and it means getting rid of the old and damaged cells to make room for the new cells. And antibodies are a part of that. So you have a normal level of antibodies to your thyroid. I'll use that as an example. At most labs, it's about 36 or so antibodies to your thyroid. That's normal. But when you have elevated levels of antibodies, you're killing off more cells than you're making. By definition, that's what elevation means. So every single lupus patient had all 7 antibodies elevated years before they ever had a symptom, killing off tissue, killing off tissue, killing off tissue while they felt fine. And she did this graph, and the 0 line is not 0 antibodies, it's the normal level. So you see all 7 of them, they're elevated 5 years before they ever have a symptom. 5 years. Some of them were elevated 11 years, but all of them were elevated 5 years before they ever had a symptom. And then they hit that peak of killing off cells for 5 to 11 years, and then they start getting symptoms. And within a few months, they get the diagnosis of lupus. So she put this drawing together. She just made this up. She said, you have a normal level of antibodies. Okay, we all know that. Getting rid of the old cells to make room for the new cells. But then you have what she called benign autoimmune. It's not benign at all, but they're elevated, but you don't have any symptoms. So she called it benign. Then you have pathogenic, meaning you're getting some symptoms now. And then you get diagnosed with a disease. But it started way back at normal going into benign. That's when it started, right there, that what we call the prodromal period, which means before symptoms. That's where it starts. Now, I want you to remember that word, prodromal, before symptoms. And here you see and you understand, okay, so during this benign period, we're killing off cells, but you don't have any symptoms, so you feel fine. Yes, okay, that's called the prodromal period. Okay, so what? Well, now let's get to the brain. Back in 2017, most front pages of newspapers around the country said, Alzheimer's is going to bankrupt Medicare. This is a real problem. And the numbers were really scary. So they put a commission together of the world's leading scientists for Alzheimer's, and they said, figure out what we're going to do about this. And 2 years before they wrote their report, 2 years, but they published their report way back in July of 2019. No one paid any attention to it whatsoever. No one, because this is when the virus came out that scared everybody and was front page every day in the newspaper. So this never made any headway at all. But they showed this. And the drawing in here, I just jumped up and down when I saw the drawing that they put in here because it explains so much. Here's the drawing. And notice there's a prodromal period in the development of Alzheimer's. And it goes for 20 to 25 years of elevated antibodies, killing off tissue, killing off tissue, killing off tissue, while you are in the I feel fine syndrome. Then it moves into, where did I park my car in the parking lot? Short-term memory loss. And where's my keys? And that goes on for 5 to 7 years. Now you're 25 to 30 years into inflammation in your brain, killing off tissue, killing off tissue, killing off tissue. Then you get diagnosed with Alzheimer's. mild Alzheimer's, as if it came on yesterday or in the last couple of months. It's been occurring for 25 years. You just never knew it because it was in the benign period of killing off cells before you killed off so many cells that the tissue couldn't function right anymore. And this comes from Blue Cross Blue Shield. They published a study in February of 2020 that nobody paid attention to because of the virus. And they said, we got a problem here. And in the 4-year period, there was a huge increase in claims for Alzheimer's, a huge increase with Blue Cross Blue Shield. And this is the one that really scared me. A 407% increase in claims for Alzheimer's in 30 to 44 years old. 407% increase. People are getting sick and inflamed in their childhood because there are so many toxins now, and nobody pays any attention to it, killing off brain cells, killing off brain cells, killing off brain cells. And you get diagnosed with depression or Alzheimer's, they give you medications for that, but nobody identifies the inflammation in the brain and where's the inflammation coming from. So there's a 400, this is the pandemic that no one is talking about. And this is a test. It's a simple blood test. You do this test and it looks at 53 markers of inflammation in the brain. Costs you about $500, I think, to do this test. And you find out, do I have inflammation in my brain right now? And it's not good, but no one comes back normal on this test or on the toxin test. They don't come back normal because everyone's being exposed to all of these toxins, and blood pools in the brain, 2% of the body weight, 16 to 20% of the body blood is in the brain, but the inflammatory markers are in the blood, sitting in the brain, causing more tearing of the cheesecloth, the leaky brain that's getting these macromolecules into the brain, activating the immune system, producing the antibodies that we've got. Okay, we can stop the slides now. And I'm hoping everyone is going to watch this once again, because I know I just overwhelmed the hell out of you. I know I did. I mean, this is PhD level stuff. This really is to understand. But if I can get across to all of your listeners, Dr. Eric, that this is a basic 101 concept, that 14 of the 15 top causes of death are inflammatory diseases, that inflammatory molecules sit in the brain longer than anywhere else in high concentration, and that you can measure the inflammation in the brain. How many antibodies do you have to your brain tissue that are elevated, not normal levels, but elevated levels? Then you understand, wow, I really need to find out, how am I throwing gasoline on the fire causing all of this? And when you explore that and you understand that, then you start noticing your brain's functioning better. And you redo the test in about a year. Don't do it beforehand because it's going to take a while to get the fire extinguishers to put the fire out. Well, the first step is stop throwing gasoline on the fire. So you have to figure out, how am I throwing gasoline on the fire? And a year later, you do the test, and the first time you had 19 markers elevated. Now you have 4, which means you're on the right track. Keep up, you're doing great, right? Because this is no simple pill is ever going to fix this. Never. That's why I know of 2 drug companies, pharmaceutical companies that close their Alzheimer's research departments because they realize they've spent billions. They'll never find a pill to fix Alzheimer's because you can't. It's all of the different toxins, the different triggers, and you have to identify all those and get them out of there. And that's functional medicine. That's the work that you do in your practice, why you have this thyroid podcast, so people can understand this stuff. And what we're talking about today is the real pandemic about brain function. But there's a way to get through this. There's a way to identify where's the trigger, and then what do we do about it?
Yeah, that was a pretty in-depth presentation. It was short, but like you said, it was still very detailed. And so the prodromal stage, that applies to all autoimmune conditions. Like with Hashimoto's, they have like that silent autoimmunity phase that could go on for 10, 15 years.
Right. Every autoimmune disease goes through this spectrum. It's called the spectrum of autoimmunity.
Yeah.
And Professor Yehuda Schoenfeld, one of the greats in the field in Tel Aviv, Israel, he runs the immunology department at Tel Aviv University. And 26, at the last count that I know of the PhDs who received their PhD from him, there are many, many more, but 26 of them chair departments of immunology in medical schools and hospitals around the world. They're his students. This is the godfather of all of it. He calls it the tautology of autoimmunity. But, an easier word to understand is the spectrum. And it starts with normal level of antibodies, benign level of antibodies, pathogenic level of antibodies, the diagnosis of the disease. Every single autoimmune disease that they've examined goes through this same pathway. It's no mystery anymore.
Yeah, and just to clarify or reinforce what you mentioned, so your goal when it comes to autoantibodies isn't to get them to zero, but just to get them ideally within the range. So if there's some antibodies present, but
they're supposed to be there,
that's fine. Yeah,
that's right. They're supposed to be there. They're part of the autophagy process
Yep.
to get rid of old and damaged cells. And when you stop making new cells, well, you can't make new cells unless you get rid of the old cells, or else you're going to get bigger and bigger, right? Like a balloon or something. And when you stop making new cells, you start aging really, really quickly because the old cells are dying off and you have more dis-ease.
Yeah, makes sense. And then as far as who should do the testing, so you mentioned as far as the toxin test, which makes sense, anyone looking to conceive, but should everyone who has an autoimmune condition like Graves, Hashimoto's also consider testing for toxins? Like, is that what you recommend in your practice for everybody to do the total toxin test? And
that's correct. Okay. I just saw a woman this afternoon with Graves, and I see one patient every 2 weeks or so, and it's by Zoom but I want 5 years of their history, health history before I ever talk to them. And so every patient I see, they do a minimum of 4 tests because these are not specific just to your symptoms. These are specific to the inflammatory cascade. 14 of the 15 top causes of death are chronic inflammatory diseases. Doesn't matter what you've got. It's always inflammation. That's the root mechanism. Doctors sometimes talk about root cause. Well, we did a genetic test. You've got this gene. That's the root cause of your problem. No, it's not. Genes are important, but they're not the cause. Activation of the genes is the cause. There's one root mechanism. And what you want to do, Mrs. Patient, you've got the gene for Alzheimer's. That doesn't mean you're getting Alzheimer's. But what we want to do is genes operate on dimmer switches. So we want to dim that gene down so it doesn't express itself. And we want to turn up the genes for anti-inflammatory brain function. For example, we knew back in the 1990s that 1 cup of blueberries a day, in 3 years, your brain's working as well as it was 13 years earlier. At 1 cup of blueberries a day, always organic because of the toxicity in today's world. But we knew that a long time ago, that you turn up the genes for anti-inflammation and you stop throwing gasoline on the fire once you identify what foods and toxins you have in your body and you get those out of there. You stop throwing gasoline on the fire and you give the foods to turn on the genes for anti-inflammation and regeneration, and people get better. There's 6 months from now, you go to church and you haven't seen somebody in a long time. Say, whoa, what happened to you? You look like $1 million. What? Well, I'll tell you what happened to me. I found out that I had all these phthalates in my urine and I had arsenic poisoning and I'm sensitive to gluten. So I got rid of all that stuff. I got nail polish that doesn't have phthalates anymore because when you apply nail polish, the phthalates are in your bloodstream in 4 to 5 minutes. That's what makes the polish hard. And I got rid of all my plastic storage containers and I got glass storage containers. My book tells you how to do that. Here's 3 URLs for glass storage containers. Miles Kimball and Amazon, whoever the third one was, I don't remember. And, I got plants in my house and we got rid of all this stuff. And My kids are better in school. They're doing great. They're happy. I've lost X number of pounds. My energy's up. My husband is sweeter than ever. My life is great because I took the time to learn all of this stuff that I had no idea about. That's what happens to most people. If they focus and do this, first thing you have to do is test and identify how are you throwing gasoline on the fire. So the 4 tests that I recommend, the gut zoomer, the Neuro zoomer plus, the wheat zoomer, and the total tox burden. Those 4 tests will identify if you have a leaky gut, you have a leaky brain, do you have inflammation in your brain, do you have a sensitivity to wheat, and what are the toxins that you're accumulating? Is it mold, is it phosphates, is it petroleum products? That test looks at 87 different markers of inflammation, chemicals and toxins and heavy metals. So you do those 4 tests. And as a matter of fact, Dr. Eric, you and I were, it's okay if I say this?
Yeah, go ahead. Yeah, we were chatting before about me looking into doing the total toxic burden test. So.
Yeah. When I'm on stage, talking to doctors, I always challenge them. I say, there's nobody's health you know better than your own and your spouse. You know them better than anybody else, yourself and your spouse. So do these tests on you. And when you'll be surprised and you'll be startled by what's going on in your brain and what toxins you've accumulated. But now you'll learn what to do about it, right? And in 6 months to a year, you redo the tests and you see, wow, I feel so much better now. How's it going? Oh man, this is gone. This is gone. This is normal. Arsenic's still a little high, but much better than it was. Good. This is and you'll see. So Dr. Eric and I were talking before we turned on the recording. I said, Eric, well, why don't you and your wife do these tests together and invite all of your followers to do the tests? And then I'll come back on in a few months and we'll interpret the tests. And we'll talk about what to do. And what was your response to that?
My response was, I don't know if I want to see what the test looks like. And again, I do a lot. I mean, I do sauna like 3 times a week and trying, of course, to eat organic. So, but it's just one of those things where I know no matter what we do, there's still going to be a toxic burden. So, but
right.
Yeah.
Right. And that's very human. It's very human to say, I don't know if I want to know. I don't want to know, because you think you're stuck. You're not stuck. You're missing something. For example, mold in your house, as an example. It might not be seen. You can't see it. You can't smell it, but you're breathing it every day. And over the course of months and months and months, I had one patient come in, the president of a bank in Chicago. His staff called me. This is when I lived in California. He said, we want to fly you to Chicago to see Mr. So-and-so. And I said, I'm not going to Chicago. I don't want to go. He can come here. And he said, well, no, but I didn't want to go. So he and his wife decided for a holiday, they flew out to Los Angeles and they said, well, we're going to rent a RV and we're going to drive the coast, and see California, like from San Francisco to San Diego. And I lived in San Diego. So they flew out and they did that. And I don't have an office in San Diego when I lived there. I meet people by Zoom, but I met him at a coffee shop and we're sitting there talking. And it took me about 3 minutes to ask, and his problem was his brain wasn't working anymore. He couldn't focus. He had to take a leave of absence from his job because he just couldn't focus. He had been to the world's best clinics. They tested everything. They could find nothing. MRIs, CTs, photo scans, just everything that they did, they could find nothing. So he had sent me those test results beforehand so I could see there from the traditional tests they had done, there was nothing. So it took about 3 minutes. We're sitting there and we had just gotten our coffee. And I said to him, so when did your basement flood? And he went, how did you know my basement flood? And well, when did it flood? About 1.5 years ago. Okay, and when did your symptoms start? About 8 months ago. Could that have something to do with my symptoms? So, I'm originally from Chicago. And he lived in Chicago. And, sometimes you get rains and sometimes basements flood. So his basement had flood, and they brought a crew in to clean it all up. They put dehumidifiers down there, but the drywall had absorbed the water up the wall a ways. And when they cleaned the carpets, they pulled the carpets, they cleaned all that, but the drywall, I said, if you go home and drill a couple little holes in your drywall, you're probably going to find, so have a professional come in to do it, you're probably going to find there's black mold in the walls. And there was. And when they remediated the black mold, when he got out of the house, I said, don't go back in the house. If you want to go back to work, you need to live in a hotel until this is remediated. And you can get it remediated in a couple of weeks, but do not go back to the house. And he was back to work in a few weeks. His brain was working better. And they remediated the house and he was fine. But it doesn't matter how much money you have and you see the world's best, they're not trained in environmental toxins. Mayo Clinic, they're not trained in environmental toxins. It's rare. Sometimes you'll find a doctor who's gone through the functional medicine training and they know this stuff and they're starting to deal with it. But it's just not commonly taught. So
yeah, I agree. I'll take you up for that challenge, by the way. I don't know if my wife will agree, but I'll definitely run that by her. And if either way, I definitely will.
Marvelous.
We'll do the test.
And then I'd suggest you send an announcement out to all of your followers and say, hey, I'm going to do this test. If you want to do it with me, you're going to get a free interpretation from Dr. O'Brien. And so you can find out, and I promise it doesn't matter what you find. It's all reversible. The more problems you have, when I had my office, I've known this concept for a long time. And when I had my office, people come for their first test or first exam and they're nervous, of course, and we run some tests and make a general recommendation of a general diet to follow and all that, and come back in 2 weeks. The test results will be here, and they come back and they're always very nervous. They always are. What do the test results say? And they'll sit down and I'm looking at the test results and I say, I've got some really good news for you. You're a mess. Look at this. This is out, this is out, this is out, this is out. And I'm smiling. I said, this is so great because now we know why you feel the way you do. Mm-hmm. Now we know. And now we're going to fix it. This will take 2 weeks. This one will take 4 or 5 months. This one will take a while. It's going to take a while, but you should start feeling better within a few weeks. It's not going to take long, but you'll have most likely some relapses in there as we're working because you'll cheat. You'll go out to eat something that you shouldn't eat, and you're going to feel sick as can be the next day. And you're going to call me and say, good, I'm glad. I'm glad you don't feel well. Now don't eat that stuff, right? But
agreed, yeah.
This is functional medicine. You've got to identify how are you throwing gasoline on the fire. And when you do that and you start to address that, you change the lifestyle. Yeah, as clean as your lifestyle is, you're still scared of what you find, right? And that's true. That's true for all of us. But when you find out, then you'll put the time into learning, what do I do about it? And then you'll start changing it.
Agree. Before we wrap it up, can I ask you one more question, Dr. Tom?
Of course.
All right. So you mentioned glyphosate earlier, and then you also mentioned you recommend everybody do the wheat zoomer. A common question people ask, and I'm sure you get this all the time too, and you're in Italy right now. So I heard that it's fine to eat wheat gluten outside of the United States, but not inside of the United States, maybe because of the glyphosate that's within the United States. So should people avoid, especially with autoimmune conditions, but I know, you recommend for everyone to avoid it. But so does it make a difference as far as gluten here?
I understand the question.
Yeah.
I understand the question. Yes, happy to answer it. A couple of things. First, I never recommend everyone give up wheat. Never. What I recommend is that if you have a health issue, just test to see, is your immune system fighting wheat? But do the right test. It's called the wheat zoomer because you zoom in on the problem. So that's the first thing. Second, glyphosate's here in Italy, so it's not it. The reason people go to Italy or Europe and they eat the wheat and they don't have the symptoms they have when they eat the wheat in the US is primarily one reason, that it is the FODMAPs, the fermentable carbohydrates in wheat that cause the bloating and the gas and the abdominal cramps and the pain, so that when you eat wheat products, you feel it. You feel, oh man, I just feel all bloated. My belt, I have to loosen my belt a little bit, whatever it should be. It's the FODMAPs. It's not the gluten. Only 9% of people that have bloating and gas and abdominal pain from wheat, only 9% of them have a problem with gluten. 93% have a problem with the FODMAPs in wheat, not the protein in wheat. Now, the immune system fights the proteins. So you may get the migraines, you may get the psoriasis, you may get the Hashimoto's thyroid, but you don't get the gut symptoms from the gluten. You do activate the immune system from gluten, but it's the FODMAPs that activate the bloating and the gas in the gut. The wheat in Europe is lower in FODMAPs, but it still has the gluten. So when you eat the wheat in Europe, you still activate the immune system and you get more thyroid antibodies or brain antibodies or skin, whatever your vulnerability is. You still get all that regression and an activated immune system again, but you don't get the bloating. So you think it's fine to eat the wheat in Europe, and it's not. That's one of the kinds of detail that I have in my certified gluten-free practitioner course that's online, and when our doctors and our health coaches take the CGP course, they've got it down. They understand all the cases. Here's the studies, here's the science, and they get it. So I recommend every healthcare practitioner take the CGP course. And I always tell them, look, if there's anything you don't like about it, if it didn't give you more information than you ever could have found in the past, we'll give you a refund. It's okay. It's okay. And we've never had a request for a refund because it's always, oh my God, I had no idea. I mean, that one answer I just gave you will answer for so many people. Yeah. This concept of it's safe to eat the wheat in Europe. No, it's not. You're going to bring back your MS symptoms if you eat the wheat in Europe.
Yeah. Well, thank you. That makes sense. And thank you for that explanation. And thank you for this conversation. This was great. Looking forward to having you back after myself and many of my followers hopefully do the testing and have you help with the interpretation. So
yes.
And where can people find out more about you, Dr. Tom?
Thank you. The website is thedr.com. Thedoctor.com. Just don't spell the word doctor out. Thedr.com.
All right. Wonderful. Easy enough. And thanks again, Dr. Tom. Again, this was great. And I'm sure the listeners learned a lot, and so did I.
Thank you, Doctor. Great to be with you.